you have a specific case coming up, give me a call and I can go over the fees with you. But on a generic case, I'll show you kind of the fees that we utilize for fabricating a surgical guide. Medical models are pretty pricey, and it just depends on the case and what's involved. One thing you can do with a case like that, you can do as much lab work as you want in office or as little lab work as you want in office. So if you want to go in and you want to get the impression copings and, and I'll send you the guide and you can go in and get everything going for you, you're going to save a lot doing it that way. But if you don't want to hassle with that and you just say, okay, you do all the lab work and then just send me everything ready to go, then, it's going to be a little more costly. So there's, if it's a concern of cost, we can work around medical models. We can work around, different costs. So it does vary for an advanced case like that. Basic cases are pretty straightforward, and I'll show you some of the costs that we have right here. So the whole process is, if you take a VPS, a PVS impression, you could take alginate, but, this kind of, the accuracy is pretty important at this point because it's going to just kind of follow the rest, and it's going to apply to that clinical surgical end. So we suggest a VPS, PVS impression. And then once you take your impression, then we can build your radiographic guide. Your local dental lab can build your radiographic guide. It's a pretty simple process, although it does have to be built the proper way. So if you have a dental lab that you want us to work with, then you can call us or give us your dental lab's information, and we'll train them on how to make a proper radiographic guide that's gonna work well with the technology. If not, you can send us your VPS, PVS impressions, and we'll build the radiographic guide for you and send it back. And then once you have the radiographic guide, you scan the patient. Again, as far as the scans, if you have a scanner in your office, great, and I can just make sure when you scan the second scan, you do it the right way. If not, like I said, we've partnered with a lot of mobile imaging units across the United States, and we have also stationary unit imaging centers across the United States that we've partnered with. And so, if you need a scan, let me know. We can help you out with that too. So once you get the radiographic guide, you scan the patient, and then you do the treatment plan, and then we fabricate your surgical guide. And the basic rules of utilizing a radiographic guide versus not utilizing a radiographic guide is if it's dentition supported and there's not a lot of noise, it's recommended, but you don't always need it. If it's natural teeth, then, you might be able to get away with building it with the STL. Tissue supported, it's strongly recommended just because unless you're doing vest locators, you really want those anatomical landmarks for the ideal tooth location. Bone supported, you don't need it. Just like the case I showed you, there was no radiographic guide, but if you are looking to cut down some costs along the way, then a radiographic guide might be a good thing to add to that. As far as software support, we'll help you with treatment planning the case from beginning to end. And there's a couple of different types of support that we do. The full support is where, you're treatment planning a case and, we'll come online with you and plan the whole case from beginning to end. And you don't even have to touch the mouse if you don't want to. You can kind of just dictate and then sign off on it. But you do have the option to share mouse controls so that you can actually, move the implant around and place it in the way that you want with, guided support. Limited support is for the guys that like computers and they want to learn how to do it. We can help you out with learning the software program and help you out with your first few cases, and then we'll help with learning the software program and getting to that point where you can do it independently. And in that case, we have a lot of doctors that do that. They'll treatment plan, and then they'll just email us the final case, and we'll fabricate the surgical guide. With the full support, we just treatment plan it, and then, there are guys that every case we go online and treatment plan the case. So it just depends on what you prefer. So this is kind of the whole process. We do your data conversion, so you send us a DICOM, and then we convert it into the software program. We have an hour of software support, and then we do surgical and restorative reports that help a lot with the communication, and then also fabricating your surgical guide. From a lot of just from demand, We also have a system where we do a data conversion. We have 1-hour software support and then surgical and restorative reports. We do everything except for the surgical guide. You would just send us the DICOM, and a lot of guys will do this just for patient presentation or referral presentation, referral communication, especially if you're going to do a bone graft, you don't have enough bone, you know, even with the smallest diameter implant. It's nice to be able to have those communication tools. And so, you know, as far as the support option goes, we really, our goal at IDT Information Dental is to make sure that you're spending the most time with the patient and least time with the computer. And if that means, you know, going online and doing an online meeting and planning a case every time, we definitely want to do that. But if it's quicker for you to like go on and just email it, then, you know, we definitely want to set it up in a way where that's most efficient, and that you're not working on computers and that you're working on patients. So that is pretty much all that we do a lot of stuff, but the surgical guides, it's a great technology, and I'm excited to be a part of it and fabricating guides and treatment planning cases. And our phone number and our email is on there, also our website, informationdental.com. But if you have any questions, you can definitely call me. That's my number, the 760-274-4080. And then the email, I'm really good at getting back with you. So if you have questions and stuff like that, info@informationdental.com is our email address. And then at our website, the informationdental.com, we have some other cases that we've done on there, some single site, some fully edentulous cases. So if you want to see some more cases, they're documented and posted on there. And then also there's some testimonials from doctors that have worked with us in the past. We just recently added that page to our website. So